Have you ever been like just going about your day totally normal when you suddenly realize your pelvic region feels mysteriously, well, looser?
Yeah, or maybe it just feels heavier.
Right. Or even carries this dull, unexplained ache. And you realize this only happens at very specific times of the month.
Exactly. It's one of those things you might only notice in passing.
Yeah, like a sudden feeling of pressure or a weird dragging sensation, and you just sort of shrug it off. You think, well, that's weird, and you keep walking.
You do, because nobody really talks about it.
They don't. But it is a very real, very common physical experience that almost no one is actually talking about.
It is incredibly common.
Mhm.
And yet, so many people just endure that sensation completely silently.
Yeah.
They think there is something fundamentally broken with their bodies or, they're losing their muscle tone, when in fact, there is a highly logical, really beautiful biological mechanism at play here.
Which is exactly why we are pulling from a massive stack of sources for today's deep dive.
We've got a lot to cover.
We really do. We are looking at urodynecology position statements, pelvic floor physical therapy guides, and a bunch of reproductive health research.
All to decode what's actually happening.
Yes. Our mission today is to decode the surprising, invisible connection between your menstrual cycle, your hormones, and your pelvic floor. Specifically, we are going to figure out why these laxity or looseness symptoms fluctuate so dramatically over the course of a month.
And to really understand why you feel that looseness or heaviness,
Yeah.
we have to completely throw out how most of us were taught to view the pelvic floor.
Okay, let's unpack this, because I think most people just picture it as like a static hammock of muscle.
Right, just sort of rigidly strung across the bottom of the pelvis,
Yeah.
passively holding your organs up like a grocery bin.
Yeah, exactly.
But it is not a static hammock at all. It is a highly dynamic, highly responsive pressure system.
A pressure system. Okay, so when you say a pressure system, what should we be picturing instead of a hammock?
Think of your core like a sealed, flexible cylinder or like a canister.
Okay, yeah.
Yeah, the top of the canister is your diaphragm, your breathing muscle.
Wow.
The front and sides are your deep abdominal and back muscles.
Got it.
And the bottom seal of that canister is your pelvic floor. So when you take a deep breath in, your diaphragm pushes down, which creates internal pressure.
So the bottom has to react to that.
Exactly. Your pelvic floor at the bottom has to naturally yield and stretch to absorb that downward pressure, and then bounce back up when you exhale,
Like a piston.
like a piston system. It have to be flexible.
Huh.
And crucially, the muscles and tissues that make up the bottom of this canister are heavily lined with hormone receptors.
Specifically for estrogen and progesterone, right?
Yes.
Meaning the very material of our canister's bottom seal is highly reactive to the monthly chemical weather happening in the body.
That's a great way to put it.
So if the pelvic floor is this pressure-sensitive, hormone-reactive piston, I want to start our timeline right at day 1 of the cycle.
The period itself.
Yeah, because if we're talking about a pressure system, what exactly happens biologically when the hormonal pressure drops?
That is the perfect place to start. So during days 1 through 7 of your cycle, the menstrual phase, your main reproductive hormones, estrogen and progesterone, basically take a nosedive.
They just crash.
They crash to their absolute lowest point of the month. And this profound hormonal plunge directly changes the physical composition of your tissues.
How so?
Well, because estrogen helps keep tissues supple and plump, a lack of it means the muscles and fascia become less elastic. They get a bit stiffer and honestly less responsive.
So the bottom seal of the canister gets kind of rigid and uncooperative.
Exactly.
But it's not just the absence of hormones that you're feeling, right? Because you also have to account for the physical reality of what is happening inside the uterus just above it.
You do. You have a uterus that is naturally swelling and becoming inflamed as it actively works to shed its lining.
It physically gets heavier.
Yes. So you combine the internal inflammation and the physical weight of that swelling uterus with the sudden hormonal stiffness of the muscles trying to support it.
Oh, well.
And that combination creates a very distinct physical heaviness. It is almost universally described as a dragging sensation right in the center of the pelvic floor.
That paints such a vivid picture. It's not a hammock going slack. It's like the rubber seal at the bottom of a French press has suddenly gotten stiff, right at the exact moment you're pushing a heavy waterlogged sponge down onto it.
That is exactly what it feels like.
You're gonna feel that downward drag. But wait, we also see a lot of intense pain associated with this phase, not just a heavy drag. Where does that sharp ache come from?
That comes down to a specific chemical messenger called prostaglandins.
Prostaglandins, okay.
As your hormone levels drop to trigger your period, your body releases a flood of these prostaglandins. Their primary job is to stimulate smooth muscle.
So they make things contract.
Exactly. They are what tell the uterus to forcefully contract and cramp so it can expel the lining.
Right, the classic agonizing period cramps.
Unfortunately, yes. But here's the catch with prostaglandins. They don't just stay neatly contained inside the walls of the uterus.
Well, they don't.
No, they can spill over locally and irritate nearby nerves. And this brings us to a fascinating quirk of human anatomy.
Okay, I'm listening.
Your nervous system isn't perfectly isolated. The nerves that supply your uterus and the nerves that supply your pelvic floor, vagina, and vulva all plug into the exact same switchboard in your lower spinal cord.
Oh, wow. Wait, so they share the same circuitry?
Exactly. They share the same nerve pathways. So when the uterus is violently cramping and sending distress signals to the spinal cord, the brain gets the signal, but it gets confused about exactly where the emergency is happening.
It just knows something is wrong down there.
Right. It just registers a massive alarm in the general pelvic region. This is called referred pain.
Ah, referred pain.
Yeah. So that uterine cramping can actually manifest as a deep internal ache that radiates straight down into the vaginal canal and the vulva.
And naturally, when the pelvic floor muscles feel pain, what do? They tense up and guard against it.
Which only adds to that feeling of heavy, dragging pressure.
Wait, hold on. Let me stop you there because that doesn't make total sense to me.
Okay, what part?
Well, if I am carrying around a heavy, inflamed, swollen uterus, and my pelvic floor muscles are stiff from a hormone crash, and they're locked up and aching from referred pain, shouldn't this be the absolute weakest point of the whole month for the pelvic floor?
Makes sense to think that.
Right. Like if you put me in a lab, wouldn't my muscles just fail right now?
It is totally logical to assume that. You feel terrible, so you assume your muscles are at their weakest.
Yeah.
And the sensation of heaviness is absolutely at its peak here because of the sheer volume of inflammation and the literal weight of the uterus.
Oh.
However, if we hook you up to scientific instruments and measure your actual muscular force, your pelvic floor muscles are scientifically at their weakest during the next phase of the cycle.
Really? You're actually weaker after the period is over and you feel better.
Yes.
How does that work?
It has everything to do with how the body gears up for its next big event. As we move into the follicular and ovulatory phases, so roughly days 7 to 14, your body is aggressively preparing to mature and release an egg.
Okay.
To make that happen, estrogen levels start surging toward their absolute peak. And as estrogen rises, it fundamentally changes the elasticity of your tissues.
So instead of being stiff from a lack of estrogen, the sudden flood of it makes the tissues stretchier.
Exactly. Estrogen actually alters collagen synthesis. High estrogen levels trigger a phenomenon called ligament laxity.
Ligament laxity.
Yeah. Your ligaments are those incredibly strong, fibrous bands of tissue that connect bone to bone. They're the primary structural support beams for your pelvic joints.
And the estrogen affects them.
Estrogen acts almost like a physical lubricant, making those ligaments looser and more pliable.
But wait, if the ligaments are just bone-to-bone connectors, how does that make the muscles of the pelvic floor weak?
Because estrogen isn't acting alone. Right around ovulation, as estrogen peaks, the ovaries also start pumping out another hormone.
Okay, what hormone?
It's literally called relaxin.
Wait, relaxin. I thought that was strictly a pregnancy thing.
Most people do.
Isn't that the hormone that makes your hips physically widen and your feet go up half a shoe size right before you give birth?
That is its most famous job, yes. Its main claim to fame in medical textbooks is relaxing the ligaments and joints in the maternal pelvis so a baby can pass through the birth canal.
Right.
But your body is a relentless optimist. It prepares for the possibility of a pregnancy every single month. So, regardless of whether you are actually pregnant, your ovaries produce relaxin right around ovulation.
That is wild. Your body is basically throwing a false alarm baby shower every month, flooding your system with joint-loosening hormones just in case.
Precisely. So right at ovulation, you have peak estrogen and you have relaxin flowing through your bloodstream.
And everything gets loose.
Your ligaments, the structural support cables of your pelvis, become intentionally loose, stretchy, and relaxed. Your pelvis actually becomes slightly hypermobile.
Here's where it gets really interesting, because if we look back at our canister model, if the structural ligaments holding the bony pelvis together are suddenly slacking off and getting wobbly, something else has to step up.
Exactly. Something has to keep your pelvis from just falling apart when you walk.
Yes. And that something else is your pelvic floor muscles.
Yes. You've got it.
So, because the ligaments are taking a biochemically mandated vacation, your pelvic floor muscles have to work overtime to compensate.
They do.
They have to grip and hold everything tightly together to provide the baseline structural stability the ligaments normally provide.
Right.
And because these muscles are working so incredibly hard 24/7 just to keep you aligned, they fatigue. And that profound muscular fatigue is what makes them scientifically measure as weak.
You've got it. They are overworked to the point of exhaustion. What's fascinating here is that this muscular compensation doesn't just affect the pelvic floor at the bottom of the canister.
Where else does it affect?
When your pelvic ligaments are lax, your whole pelvic girdle is fundamentally unstable.
Mm.
Women very frequently report feeling physically out of alignment right around ovulation.
Like their back hurts.
Yeah, they might feel like their sacroiliac joints are slipping out of place, or their lower back is tweaking, or they just suddenly feel like they desperately need a chiropractic adjustment.
Wow.
It's all connected to that systemic ligament laxity, forcing your surrounding muscles to constantly overcompensate and exhaust themselves.
That is such an incredible
It
paradox.
really is.
The exact time of the month when you supposedly feel the most energetic, when your estrogen is peaking and your skin is glowing, is actually when your pelvic floor muscles are the most completely exhausted from picking up the slack for your wobbly joints.
Yep.
All right, so the egg is released, ovulation happens, then what? Estrogen dips, the baby shower is over. What takes over, and why do our symptoms completely shift again?
We now enter the luteal phase, which runs roughly from day 14 to day 28. The empty follicle that released the egg starts producing a massive amount of our next major hormone, progesterone.
Okay, progesterone.
This phase is completely dominated by it. And this is where we see yet another incredible twist in the story. During this progesterone-heavy phase, your pelvic floor muscles are actually at their scientifically measured strongest.
Wait, what?
They usually hit peak strength right around days 21 to 28.
Okay, my brain is officially breaking. The muscles are at their peak strength right before your period.
Yes.
But wait, that is exactly when so many people report feeling absolutely awful. Bloated, incredibly heavy, feeling that vaginal pressure again, and sometimes even noticing more bladder leakage when they sneeze or laugh.
It seems contradictory, I know.
If the muscles are measuring at their strongest, why on earth would you leak or feel loose?
Because of what progesterone is doing to the rest of the systems inside that canister. Think of progesterone as the body's ultimate chill-out hormone.
Chill out hormone.
Yeah, its primary evolutionary job is to maintain a thick, covey uterine lining and to keep the uterine muscles completely calm and sedated so they don't accidentally expel a newly fertilized egg.
Makes sense.
But progesterone isn't a targeted drug. It's a systemic hormone. It has a deeply relaxing, almost sedative effect on smooth muscle tissue everywhere in your body.
Smooth muscle, meaning the involuntary muscles like the ones lining your digestive tract?
Precisely. Your intestines are essentially long tubes of smooth muscle that use wave-like contractions to push food through. Progesterone tells those muscles to slow down and relax.
Oh boy.
It dramatically slows down the transit time in your gut. On top of that, progesterone decreases fluid secretion globally across your body.
Like drawing things out.
Yeah, it's the reason you might notice your cervical mucus becomes very thick, dry, and tacky during this phase.
Okay.
But when you combine a slow-moving digestive tract with decreased fluid, the stool sits in the colon longer, more water gets absorbed out of it, and it becomes hard.
Oh no, it creates a massive traffic jam. You get constipated.
Yes. Progesterone-induced constipation is incredibly common. And constipation, as any physical therapist will tell you, is the ultimate arch nemesis of the pelvic floor.
Because it completely wrecks the pressure system.
It does. When you are constipated, you inevitably push and strain on the toilet. Because your core is a sealed canister, when you hold your breath and bear down, that immense pressure has nowhere to go but straight down.
Right into the pelvic floor.
Exactly.
Yeah.
That constant aggressive downward force puts an unbelievable mechanical strain on the pelvic floor.
So let me get this straight. Even though the pelvic floor muscles themselves are technically at their absolute strongest point in the month, thanks to the hormones, they are simultaneously being subjected to the absolute highest amount of downward pressure and mechanical strain from a backed-up digestive system.
Exactly. You are loading the system with excessive pressure. That straining can temporarily worsen symptoms of pelvic organ prolapse or just create a really intense, alarming feeling of vaginal pressure and heaviness.
Because there's literal pressure pushing down.
Yes. You feel worse, and you might leak, Not because the muscles are failing or getting weaker, but because the physical load they are carrying has dramatically increased beyond their capacity.
The sources we pulled from also mentioned something really specific about the bladder being affected during this progesterone phase. How does the bladder fit into this traffic jam?
Progesterone has a complex relationship with the bladder. While it relaxes the gut, higher levels of progesterone can actually increase the activity of the detrusor muscle.
What is that?
That's the muscle that squeezes the bladder to empty it. It makes the bladder muscle highly irritable and more prone to random, frequent contractions.
So you feel like you have to go more often.
Exactly. Add to that the fact that a constipated bowel is literally expanding and physically pressing against the bladder, reducing how much urine it can comfortably hold.
That sounds miserable.
It is. So right before your period, you might experience intense, sudden bladder urgency. You feel like you have to go right now, even if your bladder is barely full.
Okay, let's step back and look at this entire crazy cycle.
It's a lot.
It really is. So during the actual period, you're dealing with heavy inflammation, stiff tissues, and nervous system confusion causing referred pain.
Right.
Then, during ovulation, your body acts like it's preparing for childbirth by releasing relaxin, making your ligaments loose, which forces your pelvic floor muscles to work themselves to exhaustion.
Right.
And then before your period, your muscles are super strong, but they are fighting a losing battle against a heavily constipated gut, massive downward pressure, and a highly irritated, hyperactive bladder.
You summarize that perfectly.
If you're someone who has been diligently doing your pelvic floor physical therapy and you're feeling great, and then you suddenly leak urine or feel a terrifying sense of heavy looseness, it is so incredibly easy to panic.
Oh, absolutely.
You immediately think, I'm backsliding, I've ruined all my progress, I'm broken.
Yeah.
What does this timeline actually mean for the listener who's experiencing this?
If we connect this to the bigger picture, it requires a major liberating paradigm shift. Experiencing a temporary flare-up of symptoms, whether that is leaking, heaviness, laxity, or pain before or during your period, does not mean your pelvic floor is getting weaker over time.
That's so important.
It does not mean your physical therapy exercises aren't working.
It's not a step backward.
Not at all.
Mm.
In fact, the research clearly shows that 41% of women report distinct cyclical changes in urinary incontinence and pelvic heaviness.
41%.
Almost half the population experiences this. It simply means your pressure canister is responding exactly as it should to massive systemic hormonal shifts. Your body is doing what it was biologically designed to do.
So what does this all mean for our daily habits? How do we actually use this information to our advantage?
Well, there are a few things.
The physical therapy sources we looked at have some incredibly practical, actionable takeaways for you. And the biggest, most emphatic ones: stop panicking and aggressively doing 100 Kegels the second you feel a flare-up.
Yes, please. Kegels alone do not fix a pressure system issue.
They don't.
If your pelvic floor is already exhausted from covering for your loose ligaments during ovulation, or if it is currently overwhelmed by intense downward pressure from luteal phase constipation, aggressively squeezing and clenching those muscles is the worst thing you can do.
You're just adding fuel to the fire.
You're only adding tension and fatigue to an already stressed area.
Instead, the experts say you should be actively syncing your pelvic floor care with your cycle.
Yes.
During the menstrual phase, when estrogen is rock bottom and your uterus is a heavy, inflamed sponge, prioritize rest. This is when you use heat therapy, like a heating pad on the pelvis or a warm bath, to soothe the nervous system and relax those cramping muscles.
Heat is wonderful there.
And focus on deep, gentle, diaphragmatic breathing to help manage that internal canister pressure. Give this system a break.
And as you move into the luteal phase, when progesterone is making your gut slow and your bladder incredibly sensitive and irritable, you have to avoid the trap of just-in-case peeing.
What do you mean by that?
Because you feel that urgency, it's tempting to constantly empty your bladder before it's actually full, just to avoid a potential leak.
Right.
But if you do that, you are inadvertently training your bladder to hold less and less urine over time, which actually makes the urgency permanently worse.
Oh, wow. I never thought of that.
You have to trust your capacity and manage the constipation. First, hydrate, increase fiber, and avoid straining.
And finally, when you hit those phases where estrogen dips, which happens right before your period and during it, the actual tissues of the vaginal wall become temporarily thinner, less plump, and drier.
Yes, they do.
Don't just suffer through friction during exercise or intimacy. Use high-quality water-based lubricants to protect that tissue because the temporary lack of estrogen makes it much more susceptible to micro tears and irritation.
It really all comes down to working with the changing, shifting tides of your biology rather than constantly fighting against them or assuming that fluctuations mean you are somehow broken.
Which is such a powerful, necessary reframe. We have gone on quite a journey today.
We really have.
We've seen that the pelvic floor is absolutely not a static machine, and it's certainly not a rigid hammock. It is a living, breathing, incredibly dynamic ecosystem.
Exactly.
It is a flexible canister entirely governed by the rhythmic, biological tides of estrogen, progesterone, and relaxin. When you experience laxity or when you experience heaviness, it is not because you are failing, and it is not because your body is weak. It is because your body is successfully performing a highly complex, beautifully orchestrated chemical dance every single month.
This raises an important question, though, because this reality directly challenges a deeply ingrained societal mindset.
What mindset is that?
Well, we live in a world that often trains us to view our bodies as mechanical engines,
Mm-hmm.
engines that should perform at 100% capacity in exactly the same way with the same outputs every single day of the month. But the science clearly tells us otherwise.
Right. If the very structural support system of our core, the pelvic floor itself, is biologically designed to shift, to soften, to loosen, and to adapt so dramatically every couple of weeks, maybe we need to rethink how we approach everything else.
I think we do.
Which brings us to a final thought for you to chew on. Think about the physical spaces and routines we exist in. If a woman's pelvis physically changes its joint stability and load-bearing capacity every 2 weeks thanks to relaxin and estrogen, why are standard office ergonomic chairs designed as static, unchanging molds?
It's a great question.
Or consider the fitness industry. How many high-intensity workout programs expect the exact same heavy lifting output every week, completely ignoring the fact that the core's foundational support structure goes through a mandated phase of hypermobility and muscle exhaustion right around ovulation?
It makes no sense when you look at the biology.
It really doesn't. If our architecture changes, maybe our environments and our expectations should too.
I could agree more.
Thank you so much for joining us on this deep dive. Keep questioning the norms, keep exploring the fascinating, brilliant science of your own biology, and we will catch you next time.